Bacterial Case Study by Kaylee Salazar. In this case, a 14-year-old girl named Meg was brought into the family doctor by her mother. The mother was concerned about a rash that has been present for the past 3 weeks and seems to be growing. After her daughter, the patient, had returned home from summer camp in Vermont. She spent the month of August in Vermont, and when she returned, she had this rash, and it's not going away. During her trip to Vermont, the doctor had asked her if while she was there she was wearing any new pants or protective gear during her stay, and she said that no, while she was there, she spent most of her time wearing shorts and bathing suits, so no protective gear, no new pants. Upon physical examination of the patient, the doctor did find that she had a circular pale red rash, non-raised, smooth discolorations with a normal looking center on a large portion of her thigh. At this point, after examining the rash, the doctor asked Meg if she had been experiencing any joint pain or headaches. She had no fever or any other symptoms besides her rash. The diagnosis based on the presence of her rash and her recent trip to Vermont is most likely Lyme disease. Lyme disease is a bacterial infection caused by a spirochete bacteria called Borrelia burgdorferi. The bacteria is harbored and spread by deer ticks, especially in summer months in areas with a high deer population like Vermont. Lyme disease typically causes a bullseye rash. The rash is called erythema migrans. It's not always in a bullseye pattern. It doesn't always have a red center as shown in the picture on the top right. This is the erythema migrans, as the patient has the same appearance to her rash with the circular, smooth, pale red discoloration. The picture on the bottom right is Lyme disease compared to ringworm. They are pretty similar in appearance, except for that the ringworm is raised and not smooth. So, based on this patient's rash, we can confirm the Lyme disease. We can also, in these cases, do a blood culture and confirm the spiral-shaped Borrelia bacteria, but it's not always necessary or recommended. The people most at risk of contracting Lyme disease are people who are exposed to deer ticks, so people who live in the woods or forests where deer populations are high and the deer ticks are present to spread the infection are the most at risk. Backpackers, hikers, hiking through these areas. It is a non-fatal progressive disease, and in the later stages, once the bacteria spreads, it attacks the joints, which is why the doctor had asked Meg if she was experiencing any joint pain. It can also attack the nervous system and the heart. In late stages, going untreated, it can cause severe disability in Lyme disease patients. In this case, the patient can be treated effectively with a course of antibiotics. Amoxicillin and doxycycline are effective for curing Lyme disease in these early stages. A course of about 2 to 3 weeks should clear up the infection, and she shouldn't experience any of the joint damage or neurological complications associated with Lyme disease. But later staged Lyme disease, even if treated with antibiotic therapy, can unfortunately have long-term effects on the patient. The best route of action against Lyme disease is prevention, and prevention against Lyme disease can be accomplished with wearing proper protective clothing, such as long pants and boots when in areas where the deer ticks could be present, mostly on the East Coast or in areas where there are the high deer populations. Insect repellent and protective clothing, as well as proper tick removal if you do get bit by a tick. As soon as you notice the tick, uh, the proper removal and quick removal of the tick can prevent Lyme disease. The longer that the tick is attached, the higher the chances of being infected with the Borrelia bacteria are.